As this pandemic has gone on, things have been changing constantly as new evidence is coming to light. Masking is one of those things that, the evidence has been changing a little bit. Just to be clear, what are masks used for? So they're used to protect others from your respiratory droplets that could contact them. And then a mask can also be used to protect you from other people's respiratory droplets when they're talking, speaking, coughing, or sneezing that could sort of contact you and land on your eyes, nose, mouth, your mucous membranes, where this virus can then get in. So there are sort of other more effective methods that we can use to prevent sharing of our respiratory droplets. One thing being cough etiquette or sneeze etiquette, where you cough into your sleeve rather than into your hands, which then are more likely to go on to touch people and the environment around us. The other thing would be hand hygiene, making sure to wash your hands after you do, come in from outside or having touched other things external to you. And then 3 would be physical distancing, maintaining that 2-meter distance or separation from those around us. Now, masks are potentially sort of an additive measure to that, but are sort of a lower on the spectrum of options available to you to help protect you. So who should definitely wear a mask? If you have COVID and are living with other people in your house that aren't yet affected or symptomatic, then it would be important for you to wear a mask if you're in the same room as them, especially if you're less than 2 meters. Same with if you're sick and waiting for your test results to come back. If you are taking care of someone who is sick with COVID or another illness, you also might want to wear a mask to protect yourself. If you have a compromised immune system and you need to go out in public and you may not be able to maintain a 2-meter distance from others, a mask may also be advisable. So there are lots of different types of masks that you might find out there. There are some really fancy sort of big pieces of equipment that are respirators, typically designed for certain occupations that might get exposed to different chemicals or particles or infectious agents. Now, they have different design considerations. Some of them might have an expiratory valve that may have a filter on it or require a filter to be put on it, and some may not have a filter but have a valve, and then droplets could still be coming out through that valve, and so that may not necessarily protect those around you. There are other sort of healthcare grade masks, N95 respirators or rated masks that typically provide protection to the wearer and protection to those around the wearer. And then there are things like cloth masks, which should provide adequate protection for those around the wearer, but may not sort of be equivalent level of protection as a healthcare quality mask to protect you necessarily from other secretions, but there is, some additive benefit of that barrier. Now, for some people, it may not be easy to wear a mask or to not touch the mask and then go on to touch your environment, especially like young kids could have difficulty with that. Other people might feel like it's uncomfortable to wear a mask or may have difficulty breathing through a mask for prolonged periods. And for others, it may just be a personal choice. If you are going to wear a mask, try to wear it properly. So that means wash your hands before you put on the mask so that you have clean fingers that might be touching your face. Make sure when you wear the mask that your nose and your mouth are covered. So this is just my mask for the day. So make sure it goes all the way, covering your nose all the way below your mouth. Don't wear it below your nose. That's not going to give you good protection. And you want to, so I'm just going to put mine on with an ear protector. You want to stretch the mask so all these folds open up. It makes it easier for you to breathe through. And then you want to pitch the nose part so you get a decent seal around your face. And you want to make sure that you don't touch it while it's on, and if you do that, you wash your hands right after. And when you are removing the mask, make sure you do so with the straps and not, touching the front of the mask, because that is the contaminated part of the mask. So at the end of the day, I think it's really a comfort level question. I don't think there's a right or wrong answer. There are some people that likely benefit more from wearing a mask compared to others. I think the key is to keep that physical distance, keep your hands clean, and do good cough etiquette. At our children's hospital, patients and staff are being masked, and that's because in a healthcare environment, we often can't maintain a 2-meter distance of separation from each other. So I hope that gives a little bit more clarity around masking and what they're used for and where they may be of more benefit. And again, evidence may evolve and this guidance may need to change again. But thanks again for your questions, and we're happy to help respond as needed. Take care.